I'm Dr. Matthew Milowsky, Associate Professor of Medicine in the Department of Medicine and Division of Hematology Oncology and Section Chief of the Genitourinary Oncology Service at the University of North Carolina at Chapel Hill, Lineberger Comprehensive Cancer Center. Today I'm going to speak to you about testicular cancer. The testicle is an organ that is composed of different types of cells. There are cells that are involved in the production of hormones, such as the Leydig cell, which is involved in the production of testosterone. And there are also cells referred to as germ cells. These germ cells give rise to the gametes that ultimately fuse to lead to the production of the embryo. These gametes in men are the sperm, and in women are the ovum or the egg. And these germ cells can develop into cancers. And for the purpose of the conversation today, we're going to be talking about testicular cancer, more appropriately referred to as testicular germ cell tumors. Testicular cancer is a disease of younger men occurring in the age range of 15 to 35. It affects approximately 7,500 to 8,000 men in the United States each year. Although there can be an inherited risk for testicular cancer, this is actually quite uncommon. A more common risk factor for testicular cancer is referred to as cryptorchidism, or undescended testes. The testicles can be found in the abdominal area or in the inguinal area, and by a procedure called an orchiopexy, the testes can be put back into the scrotal sac. If patients have this done at a young age, then it significantly decreases the risks that's associated with cryptorchidism or undescended testes. The classical textbook symptoms for testicular cancer is a painless testicular mass, but more commonly patients actually have some pain or discomfort associated with the testicle, or they note enlargement of the testicle. They may bring this to the attention of their primary physician, who may initially treat them for an infection such as epididymitis with a course of antibiotics over 2 weeks. If their symptoms do not resolve, then patients are then referred to have an ultrasound performed and to a urologist for further evaluation and management. The best diagnostic study for testicular cancer is an ultrasound, which is actually quite definitive in making the diagnosis. If the testicular ultrasound is abnormal, those patients are generally referred to a urologist to remove the testis. And this is done by a radical inguinal orchiectomy, whereby an incision is made in the inguinal region and the testicle is removed. Additional studies that are performed when a patient is diagnosed with testis cancer include a CAT scan, typically to look at the areas of the abdomen and pelvis, as well as either a CAT scan of the chest or a chest X-ray to look for any spread of the cancer. In addition, testicular cancer is unique in that it often produces markers that can be measured within the blood. And so these markers are actually incorporated into the staging system of testicular cancer and are involved in decisions related to management. If you recall, I initially explained that testicular cancer is derived from germ cells. And there's actually two main types of testicular cancer. On the one hand, there are seminomas, and then there are non-seminomatous germ cell tumors. These non-seminomatous germ cell tumors are composed of different cell types: teratoma, choriocarcinoma, yolk sac or endodermal sinus tumors, and embryonal carcinoma. If a patient has any component of a non-seminomatous germ cell tumor, that is, any of those cell types within their tumor, it is by definition a non-seminomatous germ cell tumor. If they have purely seminoma, then they are diagnosed with a seminoma. In addition, I had previously mentioned tumor markers. If a patient has an elevation in one particular tumor marker called alpha-fetoprotein, this is only seen in non-seminomatous germ cell tumors. So by definition, if a patient has an elevation in the alpha-fetoprotein level, or AFP, they have a non-seminomatous germ cell tumor. Testicular cancer is staged in the way many cancers are, with the TNM system, that is, tumor, node, metastases. But unique to testicular cancer is the addition of S. which refers to serum tumor markers. Patients with stage 1 disease have disease that is limited to the testis. Patients with stage 2 disease have disease that is limited to lymph nodes, whereas patients with stage 3 disease have disease that involves distant areas such as lung. The serum tumor markers are also incorporated into the staging system and also used to make decisions regarding treatment. The other tumor markers include the HCG and the LDH in addition to the alpha-fetoprotein or AFP. Testicular cancer is complex in the way that it's treated. Patients with early stage disease, that is localized to the testis, are treated with a radical inguinal orchiectomy to remove the testis, and then decisions are made about what the most appropriate treatment is based on the pathology, that is what the tumor looks like under the microscope, and the serum tumor markers. Options may include the use of surveillance, that is monitoring the patient closely over the course of years with serial visits, with your physician, tumor markers and scans. Additional options include what is referred to as a retroperitoneal lymph node dissection, a removal of the lymph nodes in the retroperitoneum or back of the abdominal cavity. The reason for this is because the most common site of spread of testicular cancer is to the retroperitoneal lymph nodes. That's because the testes originate in the back of the abdominal cavity below the kidneys and descend during the development of the embryo into the scrotal sac. So the spread of the cancer from the testes in the scrotal sac is back into that area within the retroperitoneum. Additional treatment options for patients with localized testicular cancer, again, depending upon the features of the pathology, the way it looks under the microscope, and the tumor markers, may also include the use of chemotherapy. In the treatment of patients with early-stage seminoma, there also may be a role for the use of radiation therapy to the lymph nodes in the retroperitoneum. In patients with stage 2 testicular cancer that involves lymph nodes, in the treatment of patients with seminoma, the options may include the use of radiation therapy or the use of chemotherapy. And in patients with non-seminomatous germ cell tumors, the treatment options with lymph node involvement may include the use of a retroperitoneal lymph node dissection by the urologist, that is removal of those lymph nodes in the back of the abdominal cavity, or the use of primary chemotherapy, in part depending upon the elevation in the levels of the serum tumor markers that I mentioned, as well as the size of the lymph nodes that are involved. In patients with more advanced disease that have spread of the testicular cancer to other parts of the body, the most common area would be the lung, or have significantly elevated serum tumor markers, the treatment is typically upfront chemotherapy. Patients generally receive a regimen that includes 3 chemotherapy drugs, bleomycin, etoposide, and cisplatin, or a 2-drug combination composed of etoposide and cisplatin. The part about testicular cancer that's so important to understand is this is a truly curable malignancy, with greater than 90% of patients cured. In patients with localized disease that is only involving the testis with no evidence of distant spread, that cure rate is close to 100%. So the key to testicular cancer is having the appropriate management of the disease, and it's extremely important to understand that treatment doesn't end after you receive your therapy. You need to continue to follow with your physician over time, and this may go on for years after your therapy. So there are important survivorship issues to consider in this particularly young population of patients, that is, young men who develop testicular cancer and are treated with therapies including surgery, chemotherapy, radiation therapy. These are things that you should discuss with your doctor. Issues relate to the risk of chemotherapy in the long term and the short term. That is, typical side effects of chemotherapy, whether it be related to fatigue, nausea, vomiting, lowering the blood counts, and the risk of infection, or long-term toxicities as related to chemotherapy, such as the possibility of an increased risk of heart disease down the road, or things like diabetes. In addition, patients are concerned about the issue of paternity, being able to father children. And all patients should be recommended, when they're initially diagnosed, to perform sperm banking. With this in mind, the majority of patients, over 50% and close to 85% by some studies, will be able to achieve paternity, that is, fatherhood, and have a child. Additional concerns related to radiation therapy as well as chemotherapy relate to the possibility of the development of secondary type cancers related to these therapies, things that patients need to be monitored for years. And these are only some, but not all, of the potential issues that may arise. There are emotional issues such as depression that patients should be monitored for. Patients should be followed for other lifestyle issues such as smoking that could increase the risk of some of these other problems that can arise as related to your therapy. So what are the sort of things you should be asking your physician when you're diagnosed with testicular cancer? Well, for one, what type of testicular cancer do I have? Do I have a seminoma or a non-seminoma? What's the stage of my testicular cancer? Do I have an early stage or a later stage disease? What type of treatment modalities will be used to manage my disease? Again, remembering that there are roles for chemotherapy, surgery, radiation therapy, and very important to remember, a potential option in patients with early stage disease of surveillance or close monitoring with no intervention. Other questions to ask your medical team relate to issues of survivorship. Patients may have questions regarding the follow-up schedule for their disease, monitoring over time, how often their physician visits will be. Issues related to paternity, the importance of sperm banking should be discussed with your physician as well. As a young patient being diagnosed with testicular cancer, this can be extremely overwhelming, as any diagnosis of cancer is. And you should always remember that you've got a support team at all times, including your physician, your nurse, your social worker, other support services within the hospital, and Guidepost of Strength can provide mentorship to take you through this journey.